I was a brand new nurse in the emergency department in 1981 when the Hyatt Regency Skywalks event occurred. And talking about that incident, we all said, there's a better way to do this. And to do this, we need to do this regionally. Emergency preparedness is just what it says. We make sure that our hospital is ready for any disaster or emergency that should happen. It's important to me because my family lives here. And I want to make sure that our region is equipped and ready to handle a disaster that happens, because it could be my family that's involved. And I want us to be the best prepared that we can be.
Emergencies do not impact just one organization and one institution. It impacts several, and we're all interconnected. Natural events that could happen. There could be a tornado or a severe weather condition that could happen here. Or it could be just a COVID emergency like what we had. But somebody has to prepare the organization to be able to handle that in advance of that happening. So it would take drills, it would take development of protocols, it would take development of procedures, and educating even general public. At the end of the day, keeping them all safe. That's the goal. That's what she does.
Kansas City is all about collaboration and partnership, and we do that so successfully. We don't see Missouri, Kansas, we see one Kansas City. Carolyn is of that mindset and brings that to all of the work that she's done in the region for so many years.
Well, I have probably been to about every committee in emergency services, and I will tell you this region does it better than just about any region I've seen in the United States. Now, especially as a healthcare coalition, we are fully immersed in regional response, and that is awesome. So COVID-19, when it was first coming out, we were saying as a region, as a healthcare coalition, we need to be ready for this. We had put into place, phone calls to make sure everybody was up on what was happening. We had the public health departments, the CMOs, and the hospitals, all of us together. Everyone said, this is important. This was how we were able to make it through to the other side.
Carolyn was at the forefront of bringing innovation and technology into supporting emergency management and healthcare preparedness throughout the region. Carolyn Wells helped start KC Heart, which is Kansas City Hospital Emergency Amateur Radio Team. And that was an effort that came about following the hurricanes, Katrina, Rita, all of that in 2005. And hospitals lost their communications. So amateur radio was identified as, when all else fails, amateur radio is the last resort. So that was an unprecedented move for over 30 hospitals in the Kansas City region. No one had accomplished anything like that nationally.
This is N0CJ on KC4WCG. Do you copy?
N0CJ, this is KC4WCG.
It's a really bad day if you're relying on amateur radio equipment. Quite honestly, that's true. It requires specialty training. It requires a whole lot of things that are sometimes hard to deliver. Carolyn came to me and said, we'd really like to do this in our hospitals. And I said, well, let's do it. Let's simple, basic voice communications, data communications. We made sure we had trained operators ready to go. And we've been doing that ever since.
Thank you, ma'am. This is KC4WCG, and we are out.
So the Healthcare Coalition has also been invited into the Kansas City Emergency Operations Center for large-scale events. We participated in the Super Bowl parade in 2022. We participated in the Super Bowl parade in 2023, 2024. During the 2024 event, everyone knows the event was almost over and was such a happy, joyful experience for everyone in Kansas City when the shooting happened. Carolyn, myself, and many others helped coordinate the healthcare response and made sure that that response was as seamless as possible.
We were able to call the hospitals that were closest and said, be prepared. Make sure we had a bed poll go out, and we were able to coordinate with EMS where those patients were going. That is a perfect example of how planning directly leads to a good response. It's tragic that it happened, but the response that we did saved lives. All of that regional work, all of that planning, all of the relationships that we have built over the years just came to fruition on that day. All of that planning was worth it.